Dear colleagues, good afternoon. Thank you very much for finding the time to join our today's webinar. Today we are conducting a new meeting. So this is specifically for professionals in palliative care. And today we invited our colleagues from Belarus Children's Hospital and from the Republican Clinical Center for Children's Palliative Care from Belarus. So we would like to talk about the current condition of the palliative care in the Republic of Belarus. And I'm really impressed by this figure. So for almost 30 years in Belarus, they have had a special support system for children with incurable diseases. And of course, the colleagues have gained a lot of experience. And I would like to thank the colleagues for their willingness to share their points of view. So our webinar is conducted in Russian, but if you feel it's more comfortable to listen to it in English, then on the panel you can see a special icon in the form of a globe. If you press it, then you can switch between two languages. You can select the English language there and listen to the English version of our today's webinar. Today we are joined by simultaneous interpreters Maria Bычkova and Ludmila Vassiliuka. Thank them very much for helping us in this. My name is Ira Chernazhukova, and I am presenting the Foundation, the Palliative Care Foundation. So this is a philanthropic foundation, and we support specialists in palliative care in Central Asia, in Europe, in the Caucasian region. And also on our side, we are trying to make sure that they can get certain experience, knowledge. We help them on that. I think that this is one of the main tasks in our work. Today, I'm going to act as the moderator, and taking advantage of this opportunity, I would like to analyze our next meeting, which is scheduled for the 30th of October. Later on, we will also share relevant information in our social networks and in our chats. We invited Nukat Federmeses, founder of philanthropic foundation Vera, and an expert in the sphere of palliative care. She will tell us about palliative care at state level and the way it is structured there, and will tell us what kind of steps should be taken in order to move forward from the stage of initiative up to a fully functioning system for rendering palliative care. Apart from that, I would like to tell you where you can find out more about our announcements. Here is our website. You can subscribe to it. Apart from that, we also have a page in social networks. Right now, we are developing it very actively, and so we will be glad to see you there. And actually, the main location where we immediately post our announcements, this is our Telegram chat. Right now, in our chat, you will find a link to a special Google form. We are kindly asking you to fill in this form, and if you want to join it, if you want to receive information about professional and palliative care, there you can find relevant information. There we publish all our announcements, and also we there post information in our weekly digest regarding palliative care. We select the most important and the most crucial pieces of information regarding this matter, I mean, the sphere of palliative care. So you can check out this information, and later on we will get in touch with you and we will add you to the special chat for professionals and palliative care. Also, I would like to thank you once again for joining us. In the second part of the webinar, you will have a chance to ask your questions, so you can address them to our today's speaker. you can actually use your voice, and at the bottom of your panel, you can use the special button that is called reaction, and you can raise your hand, so to speak. You will see the sign, and when we see it, we will give you the floor. Or if sometimes all of a sudden you come up with a question, if you don't want to forget them, you can write them down right in the chat. No, I think that you can already see it's on the screen. Well, yes, you're welcome to do that. We will take a look at them and we will read them as soon as our speakers are done with their presentations. And now I would like to introduce our speakers. Today, we are joined by Anna Gorchakova. She is director of a public organization, Belarus Children's Hospice, and also head of a special course in palliative medicine and Belarus Medical Academy for the pre-diploma specialists, post-diploma specialists, and Ludmila Bomberova. She is director for Republic Clinical Center for Palliative Care for children, and she is a specialist the Ministry of Health, the Republic in Belarus for palliative care for children. Also, we have Zlat Kizin with us today. So the specialist in rehabilitation at one of the children's hospices, Ekaterina Sidoruk, psychologist at the Belarus Children's Hospice, and Irina Zueva, a medical nurse at the same establishment. Again, I would like to remind you that you will definitely have a chance to speak with the speaker, and you will have a chance to address your questions to the speaker, and also you can address your questions in the chat. I do really hope that our meeting will be useful for all the participants. Don't forget that speakers also want to hear your questions, because they want to understand what kind of feedback they can get and what you are particularly interested in, and probably there will be some room for cooperation. Of course, this webinar will be recorded. It is being recorded right now. We will post this webinar at our web chat. Now I would like to give the floor to Anna Gorchakova. Me again. Good afternoon. Yes, good afternoon. So I would like to demonstrate my screen. Well, while they are doing that, working on that, hope you can see me perfectly well. First of all, I would like to thank the organizers because that is a fantastic idea for doing that. Yes, there was a pause, but now we are back to work. Well, actually, I prefer offline, but unfortunately, there are certain rules we have to obey and some realities we have to obey. So, yes, I have already been introduced. I will try to do my best to share the most useful information. So, what you can see on the first slide, well, I don't think that's this is the most beautiful slide, and this building seems like to be very ugly, but in fact, I feel very nostalgic about this. So it is based on the basis of the first clinic, and actually, it's exactly there where the first idea of palliative care was born, and the first children's hospice was registered there. Back then, it was called just simply hospice, and it was not only for children. We thought we could work both with adult and children, but mostly it was for people with oncological diseases. Initially, only volunteers worked there, and it was sponsored by the Western world. It was a difficult time for us, perestroika, but then it changed. So it was based on an American model. I spent 4 months in America, and from there, I actually took those ideas of medical assistance. 1995, you can see there are no more just for people. We have a whole team here, a lot of doctors, a lot of nurses. I don't like the way I am right now, look like in this picture. I lost weight and now I look better, I'm more beautiful. But still, this is a picture that was taken back then. Back then, we realized there are not so many children with oncological diseases, and we realized that there were some other diseases as well. And back then, they were called cerebral palsy. Well, we know that also there was a problem with this disease. And when we started to work with these children, it turns out that they never needed so much assistance at home. They needed special help. And at the same time, a lot of them preferred to stay at home. And I remember that we took her to different places and we went there by bus. So we decided to set up a special center for daytime care, and there we had two rooms. Again, I would like to say that it was financed by the Western world. So we had um, inpatient rooms there for children, but mothers they didn't want to leave their children there. I remember just two kids, one orphan girl, a gypsy, and a boy, also an orphan boy, and he also stayed at the hospital. So they were uh, on an inpatient care. But then we decided to develop further on. We didn't have enough space. And in 2001, I would like to reiterate once again, back then we had no idea about fundraising. That was a completely different era. Internal economy didn't work. And again, we received grants. We worked with Western sponsors. So Western sponsors, they bought this building for us. Now it looks a little bit different. But so that's what we actually bought back then and what it actually looked like. This is this new building. So 2001 actually was marked by a very active development of our organization for palliative care. What about the programs that we had? So first, we had some daytime programs. We had 5 beds here. Well, and I should say that so there were a lot of people who needed that. It was both used both for oncology and also for people who had to stay at this place for a while. And as for this social break or pause, so to speak, well, we had quite an issue with that because parents they did not want to leave their children because they thought that probably they it looked like they were about to leave their children there, but we had to explain them it wasn't the case. And also parents club. If you take a look at this picture, you can see that we organize different events in the parks. We invited different people, priests, actors. So we conducted those events in quite a non-formal atmosphere, absolutely non-formal. So we just got together, and also we even drank something. You can see some bottles, but we enjoyed the time. A special grieving program. Well, actually, it started or it was kicked off with a new building. It's not just where we met and grieved. No, we also met with parents to talk about different issues. Now it works a little bit different, but back then it started where parents came to us. We made different postal cards, different things, etc., and discussed various issues. And also, this picture was taken in Serebryanka, a special program for volunteers. The most important thing that we realized is that we can work with volunteers only if there is a coordinator in place or the so-called coordinating person. But anyway, volunteers were deeply involved in the process. In 2000, we paid some money, and in 100 kilometers away from Minsk, we bought 2.5 hectares and bought this house. Initially, it was meant for siblings, but we didn't think that we were supposed to invite later on children there with serious diseases.
Well, there are people with children with disabilities as well as others, and the educational program was quite good. At those times, we didn't have proper literature, proper books. We translated books from English, and now have quite a lot of books, and we can even get confused with this amount of literature. Then we were only interpreting, and my mother, interpreter of English, was translating these books for free from English into Russian. And of course, we had a lot of trainers from the West. And again, translation of the books. Now we are not doing this because in Russia we have quite well organized palliative children's foundation. And we don't have to do this. We use their books. And at that time, we had 7 public hospices. Almost in every region, we had a hospice. Yes, we could find people, we could find sponsors, we brought them in touch, and it was not our physical hospices, but we worked with them. And the work of a state organization, public organization, the organization was minimal. We worked considerably with the state bodies, but we didn't have special state services or public services. Here is the map of Belarus, and that was before 2000. And I would like to show you at this scheme some very important things. What I would like to tell you from the very beginning, we didn't want to build communism in our country, so to speak. We could understand perfectly well that we live in this country, in this environment, and initially we worked with the State Ministry of Healthcare and the municipal ministries of healthcare. We always wanted palliative care to be part of the system, of this public medical system. And I'm trying to show you what we were doing. 2000, after I had internship in the Hospice of St. Christopher, I really liked these courses. And by the way, it was quite easy to open the same courses. I believe that not only in Russia, but not only in the Republic, but also in Russia, there was a course of palliative health based on Belarusian Medical University. And then the first regulatory document of Ministry of Healthcare, the first decree. And at that time, how we worked with the healthcare ministry. As you all know, and if you do not know, I would like to reiterate, I'm not a doctor. I have medical education. I'm a nurse. But I'm a biologist. First of all, my first education is biology. And I was director, and so to speak, there was a director is a doctor. So our doctor was the first uh, specialist who was not in-house specialist from the Ministry of Health. Now, maybe Natalia Sava is listening to me, so she was the first one. So how we worked? This way, we worked with the ministries and state institutions. The first decree, then opening of the first palliative cabinet in regionals in Gomel. It was not public completely, but it was based on the uh, hospital. The money was provided by the Englishmen. Then in 2011 in Minsk, uh, we had a palliative department open. Then the decree was changed. We had a different um, a specialist on palliative health care, which was not in-house again. And in 2013, we had another decree related to clinical protocols. And then 2015, Republic Register, the project of UNICEF. There was some project, I don't remember exactly. I would like to attract your attention to a very important year, which was 2011. Quite honestly, I didn't want it to just happen. We got land from the president and we started construction of a new building. We realized that we do not have enough space, and we also realized that we have to change something. We have to involve the state more. And that was a unique project. We had help from the English people. The project was prepared in England. We brought our architects to England, and we collected money from the whole country. I will never forget a person who sent us 20 rubles from the prison. I will never forget a granny, 86 years old, who sent 30 rubles every month from her pension. Well, it's not like every person, but many people. It was a construction like a construction of church. We had support from the state. It was not only land, it was for free, even though otherwise it would be quite expensive. And we got support from different levels. It was a unique project, and it was over in 2016. We constructed a new building for the hospice. That was a project, construction of new building for hospice. But we didn't make a hospice as it is. From the very beginning, I remember I was invited to Ministry of Healthcare and said it's better to do it with the public support. And initially, we created a Republican Center of Palliative Care. And then the colleague will tell you about it in more detail. And for that reason, by that time in the country, but for us and in Mogilov, we didn't have any public hospice. And when we left the region, we couldn't sustain money collection, and they got closed. So the only two were us and the Mogilov Hospice. And with the new center, we got the change of the structure for care provision. Now, Ministry of Healthcare was the main, and we were a little bit aside, an important part, but still. So then you will see a different scheme. And now I will show you what we look like now. Now we have 13 people. You can see our structure. We do not have an inpatient facility, and we have we can invite doctors as consultants. We do not provide medical help as doctors. That is provided by the state, and the accent is put on regions because in Minsk we have a quite good palliative care cabinet. We had nurses, and it is very important. We also had ward staff, and we have a training program for them. We have psychological program. We have habilitation well developed, and we have some small programs. We have a lot of programs and volunteer program without which we cannot work. And we also take accept up to 39 years old. That is help the patients plus 18. This is a hard program. It's quite uneasy, but I believe it is very important and necessary because, well, pediatrics in Belarus works quite well. And there are problems of shifting from pediatrics to therapeutic care. And here we are trying to solve these problems. I finalize with my presentation, and I would like someone else. Our staff will tell you better than myself. I invite Irina. Ira, please come here and tell what you are going to talk about. Good afternoon, everyone. My name is Irina Zueva. I'm a nurse in Children's Hospice. I have an education, medical education, and work for 12 years in hospice. And my work is in the provision of palliative care to children at home. I have a 50 family, 9 families in Minsk and others in region. We put a focus to regions, as it has been mentioned by my colleague. In Minsk, the palliative care is provided quite well. I move around the country with the driver. Palliative care is arranged according to the plan. I make a call in advance. I identify the needs. I identify the needs in some materials, and then I start. We have several nurses, and I have my trips 2 times a week. The functions of a hospice nurse. The first one is coordination, identifying identifying the needs, especially during the first visit. We make the plan for visits, and if family additionally needs helps of rehabilitologist or psychologist or a doctor's consultation, I identify these needs being a nurse, and I report about those to my team, and this family receives the required help. Further on, educational function, meaning, especially for a child who was born with pathology and was in hospital, and mother comes back home not knowing what to do and how to take care of the child, then the nurse teaches how to take care of the child, general care as well as specific care, meaning like feeding, special feeding with the tube. I teach a mother how to use the tube for feeding, and sanation, then special treatment, gastrostomic treatment and care, feeding with gastrostomic facilities. And then sometimes I can replace gastrostomic. It can be provided in a tube. Sometimes when it is in Minsk, for instance, a mother cannot always feel free to go to a doctor. It has to be done quickly. And then uh, take care of the bed sores, positioning in bed, how to put the child correctly in bed. If I see that my consultation on proper positioning in bed is not sufficient, then I invite abilitologist, and with a special request, abilitologist is arriving to them. As generally I am a nurse, normally we have quite close contact with the family. I need to know how to provide first psychological help. As long as while communicating with the family, I get involved into their uneasy family relations. And again, there are different issues. If I cannot cope with it myself, I invite a psychologist, a child psychologist, to to make a test for a child and identifying some problems. And the manipulative function as a nurse, I should know how to provide medical care before the doctors come, all the injections naturally, also installation of the tube, and so on and so forth. At every visit, for every child, I make the visual observation procedure. I definitely listen, measure separation. I observe dynamics, how the child looks like, and I consider the dynamics, whether a child is getting better or worse. I talk to parents regarding all these. Also, we focus on telephone connection. It should be 24/7 with the parents. Parents can make a call anytime if they have some questions, some serious questions. I also coordinate them or I can answer their questions. And quite often when we communicate on phone, I accompany the dying of children. Quite often we have children with oncology and non-oncological diseases, but with the diseases which result in dying of a child. And talking about accompanying of dying by phone, recently there was a case in September in a region. There was a family, a mother and three children, two boys who are 16 years old. Why am I saying this? These are from the first marriage, and both boys had progressive Duchenne neuropathy, and I visited them. They were under our care for 3 years. One boy died a year and a half ago in February last year when he was 16. He died quickly, unexpectedly, that was in the night. And the second boy, his brother, died September this year, a year and a half after. And the mother was really scared to miss something, not to do everything she should. And quite often we talk by phone, we discussed all that. Yes, she understood that it will happen, but he had a VL machine, ALV machine, and when this child started dying, it lasted for 4 hours, and the mother called me. Of course, it was very hard. I just told and asked a question and asked what's happening.
So she explained everything to me, and I, in my turn, explained everything to her, saying what she was supposed to do next. She kept asking question like, maybe it's possible to still save him. So I just explained that give him his emotions, stay by his side, etc. So then the doctor, local doctor who was with her, he called an ambulance, and I had to talk to the people from ambulance and also with that local doctor because the child was in the agony. But when they called ambulance, they were obliged to reanimate the child, but they didn't do it. So they allowed him to die peacefully. So everything was done in a decent way, so to speak. Well, actually, I've never done that before. That's why I forget to. I'm afraid to forget something. Usually, we provide equipment for everyone involved, and nurses they are supposed to be able to use that. So I'm talking about electric pumps and also oxygenizer and all those things if needed. Irina, thank you very much. So you have gained quite a unique experience, something that you went through that is incredible. And I understand that it was not that easy. Well, I try to be as brief as possible, okay? Well, take your time. It's gonna be okay. My name is Ekaterina. I'm a psychologist by profession, and I would like to say a few words about how actually psychological assistance is provided. Actually, we have three main areas. The first one, there we work with our parents of ill children, work with children themselves and their siblings, and also work with young adults. And actually, I'm responsible for that, work with young adults. So people with different problems. Three completely different areas of work. They have their own specificities. I'm not going to go into too many details in case you have questions. I think I will be able to answer them. So as for young adults, well, these are people aged 24 up to 39. So children, I wouldn't say even children, they are adults. So either with some diseases they live with throughout their life, or the disease condition that's actually appeared because of a certain situation or some illness. After that, their health got worse, and so they needed palliative care, or maybe an accident where people became handicapped. So as for this kind of work, well, I would say that such young adults, some of them already have families. Sometimes they manage to preserve their family. Sometimes it's not the case. Well, in any situation, if a person is deprived of all the capabilities, well, of course, this person is always lost. And my work also is all about explaining him or her his or her condition. We don't want to make them aggressive or something, and we want to prevent these outbreaks of aggression. The same is applied to parents because they have to understand what happens with their children, whether it's just a small kid or a young adult. We are always children for our parents, and if, for example, little kids can manifest certain aggression. And not long ago, we had a conference dedicated to this issue of aggression, and I'm glad to see some people who participated in that conference. So it's very important to identify the reason of such an aggression or a young adult and explain to their relatives, what they're supposed to do with this aggression. Many of people we work with, adults, they have quite a low IQ, but what they can understand and what they understand is also important to them. They need to understand where they are, what they can do, what they cannot do, and what their abilities are. Let's put it this way. So, and speaking about supports for children's parents, children in difficult condition. For example, yesterday we had quite a very important situation. A child was in reanimation or intensive care, and he died yesterday. And I was in close contact with his mother. The first condition they found themselves in, I mean, parents, after they learn about the death of their child, it is really difficult. On one hand, they want to be isolated, they don't want to see anyone, but at the same time, they need someone to stay by their side. And it's very important to make sure that they're not surrounded by people who just roll up their eyes and say, oh, come on, everything is going to be okay, don't cry, etc. It's very important to understand that if a person is grieving and if a person starts to cry, I swear, never say, please don't cry. If a person wants to cry, let this person cry. The only thing you can do is just to stay by this person's side. I am a psychologist, and I want to repeat it over and over again. If you can share your balance, your normal state, do this. Even if you are not a psychologist, if you are not a specialist and you don't know all these methods, how to take the person through all those difficult stages, please stay just by this person's side and assess your also condition as well as this person's state. So I still have some time, right? Yes, great. Well, as for young adults and this particular area of competences, we also have a special part of the program where we work in groups and we organize the group meetings for young adults. Usually I talk about young people with a cerebral palsy or more or less mobile people who could actually visit hospices. Well, unfortunately, last year we didn't organize that. There is one reason to that. Well, technically we can solve the issue of transportation, but when it comes to, for example, um, some other but if you talk about stretches, for example, where you have to transport person 80 or 90 kilograms, or for example, if a person lives, for example, on the second floor, third floor, etc., you need really strong volunteers to take them downstairs. It's very difficult technically. And when we find a volunteer or two volunteers, you also need to make sure that they find a common language with relatives or people who take care after those ill people. There should be the right space, the right communication, this synergy. And you know that condition might get worse all of a sudden, because they, patients, they can get really nervous, frustrated when they expect this moment where they meet these volunteers. It's very important to them. And, their temperature might go up or there might be some intestinal problems. And, this can actually really lead to certain obstacles, and it's really important to mention that, and it's very important to bear that in mind. We do not always can do anything about that, and it's not always to organize such group meetings online, and young people not physically, not always can actually look at the picture and absorb information, digest it. They cannot just see the big picture when they communicate with people in charge. That's what I wanted to say. By the way, yes, I forgot to mention the so-called sensor room. We have a special place. That's how it is called. I would say it's not a place, but a phenomena, because in fact, this sensor room with special stimulation, rehabilitation. Let's put it this way. This is for children, but also it's for adults and for parents and for young handicapped people. This is relevant for everyone, where you can relax. And actually, you know, it's not about just relaxation, about listening to some good music. It's more about this opportunity to get maximum from all your body organs. I mean, tactile sensations. You can hear, you can see, etc. And all these perception channels can be activated, of course, with regard and taking into consideration the physical condition. Because if there are some problems, psychological, of course, you cannot use any flashing lights or whatever. So everything is taken into consideration. And specialists, when they get isolated and say, for example, I have this kind of methodology and this is what I abide by. No, you need to take into consideration all the possible factors. And if you know that all the information that I need, if you have it, so then you should use it to the maximum. What's that question for me in this chat? I will answer that later on, or probably someone else will answer that. Okay, I got a little bit sidetracked. Whatever. Yes, time is up. Yes. Okay. Thank you very much for your attention. Have I mentioned that I work as a psychologist? Okay, let me do this, please. Ekaterina Sidoruk, a psychologist from Belarus Children's Hospital. And if I got you correctly, our next speaker is Zlat Kizin. Yes, exactly. Zlat, hello, we are glad to see you. Zlat Kizin from Belarus Children's Hospice. Yes, my name is Zlat. I work as a abilitologist in this hospice, and I've been doing that for 3 years. First, I would like to say a few words about rehabilitation and what stands for this term, because not everyone is familiar with that. We heard about this word. So rehabilitation is when you want to get your functions back. For example, there is a person, then something happens, and if there is a certain rehabilitation potential, then they are exposed to a certain recovery program. So when it comes to our children, there we mostly work about serious illnesses, and we cannot always develop their functions up to a normal state or normal level. Well, as for rehabilitation, we try to make them adapted to environment using some technical means, and also we teach them to interact with parents, and parents interact with the child with serious disease, and also we work on the environment inside the family. We work based on a special European approach to interaction with children. We got a certain experience while working with different rehabilitation centers in England, Poland, and Italy. The main task is to involve the child in our manipulations. It means that if we just take some passive actions, we can actually have some secondary complications and have problems with mobility as a result. Well, we work both, by the way, with the children and adults at the same time. So when person is involved in something directly, then during this kind of interaction they make some movements. Well, there is a special link between muscles and joints and I mean, nerves, etc. And we need to activate this link. If we don't do that, so then we won't succeed. We also have regional specialists, and they were also trained at the Belarus Children's Hospice. So we actually invite them, we train them, we teach new methods. After that, they go to different towns and cities. We have them in Gobel, in Znobil, etc., all across the territory of Belarus. And there they use different approaches, etc. And when we work with them, of course, when we're in Minsk, we cannot always go to the region. They should also be able to provide some special palliative care. I also work in the framework of this structure. I work both in Minsk, but also I go to different regions. We understand that in Minsk we have a lot of special specialist, but the further you are from Minsk, the less specialist you have. And there, well, people are in great demand of such kind of help. What am I supposed to do? So I select special devices for this kind of help. So I'm talking about special chairs, lifts, etc. We also need to be able to adjust them to work with different settings. We also work with also orthesis. We do a lot of other things. So we explain how you should put your child on the surface in the right way. For example, if there is some kind of a pathology or etc. We also work with secondary complications when it comes to conjectors, also bed sores.
Also, we provide study educational facilities for those who work in territorial centers. When we talk about Minsk, we invite to the hospice for training in order to cooperate with people. And we can also move out to make seminars. And we also go to region, and the farthest one was in Mstislavl, nearly at the border with Russia. What else should I mention? We use comprehensive and individual approach to every child. Uh, well, how do we work? First, we get to know what kind of opportunities a child has, what do parents expect from our cooperation, and then we make goals. The goals are not like, a person with a cerebral palsy and he should walk. We make small goals which are achievable. We do not have a task to reach something global. When we reach this goal, we have a new goal, and thus, with small steps, we try to develop the child as much as possible. Also, we work in team. There are cases when a child is anxious, when a child has, kind of membrane distortions. We invite specific specialists like child psychology, adult psychologists, play therapists. We often work in teams. Several specialists at the same time work with a child. Also, we work with a state orthopedic factory. The main task is to produce, of this factory is to produce prosthesis, and it has some department which produces technical means for social rehabilitation. And with our cooperation, we provide this for the to the plant. They take special measurements and they manufacture those according to the plan. Parents who need to purchase those with the state financing, we provide consultation and a reference that they really need this, and thus parents can receive it for free. Also, in the hospice, we have a center which is called ICE or STORK, where children with some distortions as well as adults. So we make groups according to the age, and they can come and have a good time. Well, the realist environment is not so well developed in our country, and mainly they spend time at home, and here they can arrive and have some rest. They can be specialists at one place. The advantage here is that they arrive from regions to one location, and my team and I can arrive and at the same location provide consultation to a big number of people at the same time or provide some assistance. We do a lot. We repair wheelchairs. It's just a long list to enumerate what we're doing. Even the children who are not in register for our care, they need one-time consultation can also be provided, and all the assistance that we provide is for free. We work, I repeat myself, with from children who are 6 months up to 39 years old. We provide different kind of assistance, and the main A problem is in the regions. There they have a lack of specialists, and for that reason we have a regional service which can come directly to the location where it is required. That's all I had to tell you, Zlat. And I know that there were pictures that you have prepared. Are you comfortable in switching them on? Yes, there are some pictures. It's not always an opportunity to make a picture. So here, it's good that the picture is here. I forgot to mention it. We also have specialists who are not in-house specialists, and they work according to agreement. There is children orthopedics, and children can come for free and get free consultation from a orthopedic doctor. We also have neurologists, neuro specialists, and we see such lifting machines which are provided for everyone for it to be safe for children and adults to make manipulations and movements. So we make our thesis, we teach parents how we can move children from lying position and to take a bath if the door space makes it possible to move with the help of the lifter. On the picture to the right, we recently had a tracker system. This is when a person, a child can control a computer with eyes, and you can use uh, eyes to control everything on computer. It is in demand for children with ICP and other neurological diseases. And eye tracker doesn't work with children who have knee thumbs horizontal when they have problems with the uh, pupil movement. And eye tracker, is it also working work of your department? Right, yes, so we are doing a lot of different things. And quite recently, we started making it, we did it orthesis on adhesive tape, and now we saw that there is a private company in Russia which produces orthesis on a zip, and we tried to do it. We succeeded, but again, the material for the parents to purchase this, like Turbocast, for instance, this is quite expensive for parents. And we provide this services totally for free. That means that the hospice provides financing to purchase materials. We provide it, manufacturing it. Anti-bed sores systems are also purchased from Poland. The Stabilo BodyMAP, this is for children with low weight and who can have deformation and bed sores. We have quite wide spectrum of assistance that we can provide. Yes, that really sounds impressive and looks like you can provide for complete mobility for your patients as much as possible, as much as it is possible for them and for you. And one more thing, we have several rooms in hospice. That is for, we have kind of a hotel, and McDonald's helped us to build this part. Children with parents can stay there up to 3 weeks. They have their own kitchen, all conditions for living, so that for some period of time, we could provide assistance and care for them. When they arrive, we can plan a visit of orthopedic specialists, neurologist specialists. They have a course of habilitation and child psychologist comprehensive program for a short period of time. And I tell you, that is quite important for those who are from regions. They do not have this specialist in region. Now, that's all I had to tell you. Thank you. Thank you so much for your attention. Please do not go away because definitely we're going to have questions to you. And now we would like to give the floor to Ludmila Bondareva. Thank you for having joined us. I would like to remind you that Ludmila is head of Republican Clinical Center for Children's Palliative Care and is the main specialist who is not in-house in the Republic of Belarus on child palliative care. Uh, Good afternoon. I'm very happy to see and hear all of you. Thank you for having invited us to participate at the state structure. My speech will be a little bit different from the speeches of previous uh, speakers. I will be quite official, but representing a public institution, I have to talk like this. And I would like to tell you that we work from 2016, and we try to use all modern principles and modern approaches to provide palliative care to children. First of all, if the previous model of palliative care presupposed that that was a hospice care. Now we start providing care as soon as the child is diagnosed, and that is continued regardless of the fact whether a child gets treatment or no. And it's also overcoming of the disease, and that is the principle we arrange our work. And well, it's possible to provide this care when the disorders are found timely, and individual program for rehabilitation of a child and the family, providing for availability to support special function and social adaptivity, and also palliative care, timely palliative care, which can provide for proper quality of life for a child and the family. My colleague has mentioned development of palliative care development in Belarus, and I will allow myself to start from 2016, since our center was opened. Back in 2016, there were changes introduced into regulatory acts, and children who needs long-term respiratory support have an opportunity to receive the equipment for artificial lung ventilation for free, subsidized by the budget, and also provision for healthcare in orphanages, provision of palliative care, and for children in orphanages who need long-term respiratory support. These children can get assistance in orphanages up to 18 years old. In 2019, a regulatory document was specified which identified the order of providing palliative care in Republic of Belarus. Before that, we had two documents. In 2019, we have the active modern document, which reflects all modern approach on providing palliative care to children, and also which considers all changes in legislation. And in 2020, there was a provision on a Republican register of children who need palliative care, and also in the region identified responsible people for controlling register and introducing information into this. And in 2023, new clinical protocols to provide palliative medical care to children. So as you see, a lot has been done, and now I would like to speculate in detail about the results of our work. First and foremost, Anna already showed you, we have organizational multi-level structure of palliative care to children, which includes a regional, a republican, a regional, and district centers of palliative care. You see the operation of public clinics and private sector as well, and also Ministry of Healthcare, Ministry of Labor and Social Security, houses of orphanages, and also Center of Social Service to Population, and Ministry of Education, which controls the operation for centers of correction and educational training, which identify specific programs for a child training. We have developed a complete package of regulatory documents where a provision of care is specified, and also receiving of artificial lung ventilation. Children have an opportunity to receive medicines for free. They have required medical devices such as electrical pumps and artificial lung ventilation machines, and all the equipment required for rehabilitation and habilitation required in different conditions. As I have already mentioned, we have a register of children who need palliative care, We have elaborated unified information which can be provided in the register, and the register includes the data on every patient who is specified in palliative register with all the urgent information on the disease, on the rehabilitation and debilitation events, for providing the child with the technical means of social rehabilitation, medical items.
So this register helps us first and foremost to do some planning, also the so-called perspective planning for developing assistance plans. So in the Republic, we have it in every region, and also we can provide for organized clinical assistance, and also it improves interaction with the specialists. Please take a look at this period of our center's functioning. Here is number of patients that we have. So the number of children who receive our care has grown by 1.7 times. Well, we have a lot of young people of different age. So you can see here actually segregation of our patients into different age groups. We also, like I said, work a lot with parents. Well, first of all, of course, we stay focused on patients with oncology. We work a lot with hospices. We have really improved the quality of palliative care, and many the little patients they live up to quite a good age. Here we can see information about our psychomedical psychological diagnostics. So we can see that over 82% receive this kind of assistance at home, also in children's house, 7%, and also in yeah, also, there is a certain percentage right now in the Republic. We have 135 children. We also over 70% receive artificial lung ventilation, and quite a great percentage receive it at hospitals. Most the patients they have diseases of the nervous systems, and we can see that in a number of patients of those who actually they given certain treatments. So it's really grown in size, and it accounts for quite a big share. Palliative care for children, this is a high-tech assistance, and it's rendered at the age of many professions requires special knowledge in the sphere of medical and psychological preparation. So it involves work in a team, and there we have specialists from different domains. I should say that in our center we use these methods of teamwork, and we're trying to implement it usually also in other locations as well. So our center is the main one in the Republic, and the main area of competence also related to rendering assistance to children in regions. We are not like an ordinary medical establishment. We have our own functions and structure. The priority of our work is team and connect approach, team-based. The main direction of our work is represented on the slide. I should say that in our center we have both inpatient facilities and outpatients as also assistance provided. Also, we have special services ready to go to visit our little patients, regardless of the reason why actually children are taken to the hospital. We have different specialists. We have neurologists, we have therapists, pediatricians, etc. And we actually are able to provide a full set of different habilitation, rehabilitation actions. It can cover all the possible needs our patients might have. And also we train our specialists so that they can get more information about our combined approach to our work. We also have our services, as I said, who can go to different locations to provide some methodological and help, as well as consultations. We work in different spheres. Yes, we really provide palliative care also at home. I'm talking about psychological, spiritual, social help. In the center for 5 years, we launched a special program from the children with spinal atrophy and Duchenne atrophy. We have had this program for 5 years, and it involves a number of different rehabilitation steps. Well, and well, it's very important for our patients. In the center, we have special new methods. Well, it's also an integral part of palliative care. We worked with diagnostics. We use bio impedance symmetry. We also have enteral nutrition, and we also work with non-invasive artificial lung ventilation. It's provided for children's spirometry, also nighttime pulse oximetry, etc. We also have dynamic control, individual selection, and adaptation to the technical means of social rehabilitation. Of course, a lot has been done, I should say. Everything is really great. We're quite satisfied with the results, but we're trying to still improve it. We are ready to always identify problems that we exposed to, but we need to come up with a special approaches to the organization of this palliative care in different regions, depending on local conditions. We also train people to work with our approaches. We also should work with different drugs, and we should know how to provide our children with the drugs. Also, we need to think about non-invasive access to different drugs. We also stay focused on technical means of social rehabilitation, work on organization and control over different processes involved. We are very much in favor of our approaches, and in our country, yes, we're trying to disseminate this principle of palliative care and provision of palliative care in different regions. We work with different children's house, and also in Minsk, for example, we have representation offices of different regions, and also we have a special service that can go to different locations. We have different clinics in different regions of the country. We have a really good potential in terms of specialists that we have. We have really professionals. We have special norms and standards. We also have a special payroll and people who fill in different vacancies. There are a lot of plans ahead. Really want to be able to provide assistance also in different areas, and we need to make sure that we have a very good geographical coverage. It's very important. Of course, it's clear that the basis of palliative care is all about specialists, the pediatricians in different villages, towns, and also doctors of general practice. Unfortunately, not everyone in the state sector got used to it when we open a new departments or a new, for example, room or hospital, hospice. We understand that there we're supposed to have all the professionals, nurses, pediatricians, etc., because it takes teamwork to provide full-fledged assistance. Of course, sometimes people say, of course, well, what is palliative care? Why am I supposed to know anything about that? Sometimes therapists might ask this question, and so they might say that, well, there are other people who are supposed to do that, but it's not the case. They should also be aware of the current trends. And quite a long time ago, we started to pay attention to that. In 2018, a special guideline regarding palliative care and symptom relief was published. And so we also use different provisions from these documents. So yes, it was published by the World Health Organization, and there they also go through different items, different points, articles, and give a very good descriptive part. Here are some problematic issues and ways to solve them. Well, we understand that one of the main problems right now is still about lack of professionals. So that is why we try to actually increase the number of different departments or locations where they can train pediatricians, I don't know, specialists in this or that domain. We also have special courses for professionals who work with children with serious diseases and curable diseases. We also work in close cooperation with the Department for Sports Medicine, and we also understand that doctors should be involved in this work as well. We also work with the Institute for Physical Education, and also we worked with Belarus Medical College. There they provide advice courses for different people. They also work with physical education, and also they have a special psychosexual course regarding palliative care with a particular link to physical education. So we're trying to do our best to disseminate our information and to share our knowledge as much that we can. And also want to make sure that the people they then use this knowledge that they get experience in their practice in their work. Apart from that, on an annual basis, we conduct different conferences, also with participation of international experts. There we discuss palliative care from different angles, different points of view. So we understand that as for pre-diploma preparation and these courses, there are sometimes not enough hours in the curriculum, and we insist that in higher educational establishments, so they also should allocate some time for this particular block. That we are really very much forward of in favor of developing special programs. And as I said, we want to have a connected approach to the whole matter, so that people can work in team. And sometimes that Anna Georgieva has already mentioned. Yes, she covered a lot of interesting issues. We work with different age groups, and we also work with this issue of interaction between adults and children. I'm sorry, we are just running out of time. I'm almost done with my speech. I'm almost done with my speech. Well, okay, if you have any questions and if you're interested in our contacts, here they are on the screen. Yes, sure, we are always ready to exchange our contact details. So thank you very much for this information. Yes, take a look at the slides with direct contact from our speakers. So this accounts of the Republican Clinical Center for Palliative Care, and Ludmila, as far as I understood, your personal contacts as well. So it's possible to get in touch with you using this information. Thank you very much. I would like to thank you for your professionalism, and also I can really feel it, how much you actually how many efforts you contribute into that, and you are not indifferent at all. You really care. You organize a lot of things. You are really establishing a whole structure for this kind of works, and your attitude deserve a lot of praise. So Gulnara, would you like to ask your question on, maybe you want me to ask your question? And also I wanted to say, in the camera, I mean, actually two of you can sit in front of it, and if you want to also be in the picture, so you can do this. Gulnara, good afternoon. Good afternoon, Gulnara. I'm happy to see you. Anna Georgievna, good afternoon, Gulnara. It's very nice to see you. Irina, so I am afraid I'm gonna have a problem with some background noise. Could you please do that for me? Yes, then I will ask your question. So Gulnara asked whether or not you can say a few words about the register and how it was developed. I mean, palliative care for children, how you actually accumulate data. Are you satisfied with how it looks like and what it looks like right now? This is a separate issue, in fact. This is a separate issue, but still.
First, there was one register, then it became the second one. At first, there was initially one, and then it was shifted to palliative register. It took a long time, but I believe it's a good thing, and we can make a separate meeting, and it's better to make a meeting with Palliative Care Center. We prepared it as a Western project. If I'm not mistaken, it was a UNICEF project, and initially it was very simple, and it divided well, just for people, it should be easy to enter this. It was mostly related to research work. It was on our base. Then, as we opened the center and the center had all the control, then the center upgraded it to adapt it somehow for itself. I think that I can actually fit 5 minutes. It's quite complicated. They are great, but it took a lot. But this is a separate story, a totally separate story. Please come to the website of Palliative Care Center, and they will be happy to tell you about this. Maybe Ludmila will add something about some data. Well, the register has the data for patient. Of course, so we receive an official agreement of the patient. Everything is in compliance with legislation. There is a data about the patient, and there is the detailed of a disease, all the information starting from birth, whether they have small weight or whether this was external, and about the cause for palliative care. And in our instruction, we have a part, there is a special order, and this order is downloaded into the register, and you can see how it happened. Then there can be information about hospitalizations of a child, about some rehabilitation measures, what kind of technical rehabilitation means, which medical devices a person gets, and so on and so forth. If a child had some treatment, some consultation, we also have an opportunity to download it into the register so that we would have a complete database. In the register, we not only have information, statistic information, we can also receive clinical information about how the disease is going on, whether there are improvement or not. That is briefly. Is there anything which the register lacks for now, in your opinion, and what prevents you from implementing this? Of course, we keep on working at improving the register. We make some specific marks, so to speak, not to mix anything. If there is some diagnosis which should not be in this age and should be reconsidered, there is some red indication. If a child should be carefully examined because a child is 18 years old and we should prepare all the information to shift it to adult service, there is also red indication, just for instance. What else? I tell you, when back in 2020 we developed this provision at the legislation level, because initially it was just a project. Now we introduced it from the regulatory basis. We made it legal, and in every region we have a specialist who is responsible for filling in the register. There is a specialist who is responsible for timely introduction of the data, for completeness, and for the quality of the documents which are downloaded into the register. Ludmila, and I have my last question about the register. Is there an opportunity and permission to share with the colleagues from other countries, to share your model? Maybe this is an issue of technical provision, whether you are ready to share some soft or some elaborations, or just show it as an example. We, of course, can show how it works and we can do it, but you understand that the information that is there, this is a classified information. We can show how it works, what is indicated there. We upgraded it for the work of state system so that we could get all the data we need, statistics and some dynamics, so that we could develop it for the future. For instance, we see that in some region, how many diseases, what kind of, how many children are at palliative care center in the register, how it is developed, why do they have more of these diseases, or why they do not have any diseases like this? Is it wrong introduction or on diagnosis, or we see that children with oncological diseases, they have like 5 years or 6 years, they're still in palliative care. It's good that they are in remission phase, but for that, they are no longer for palliative care. And this register make it possible to timely take care of the medical care provision. So you see, like the personal card of a patient, because if there are some responsible people, and we can only tell how it works and what kind of information we need to save. Thank you,
Да, спасибо
Gulnara.
большое. Да, у меня
Did we
тоже
answer your
немного
question? You
отвлекается.
can nod your head. Yes,
Не
thank you.
интегрирован с какой-то
Sometimes we have
более
pauses. Well, it's not
общей
integrated
системой
into some
информационным
general
здравоохранением.
system
Отдельно, да,
of healthcare institutions. No, now it is separate. And also we have a separate register for diabetes. In a similar manner, it is separate. In the Republic, we have some work being implemented for this kind of, what to call it, platform, a digital platform for healthcare purposes and so on. As soon as it
Спасибо
works, it
большое
will
за
be
этот
introduced
ответ.
there.
Спасибо.
Thank you so much for this explanation. Thank you. Also, we had a question for specifying whether we understand correctly that the patients who do not live in the availability of the center or hospice, you can provide distant care, remote care, right? And if possible, then you can visit them from time to time. Yes, we have an opportunity to visit such patients, and sometimes it's quite hard to transport them, or parents are not willing to do this. But our specialists can go anywhere. We go to clinics and we go to children's homes, we go to orphanages. And we can take any child to our center before the child is 18 from any region. Now, modern automobiles do not make any problems in transportation. Sometimes we say that maybe this child would be better and more convenient to stay at his home. I mean, at terminal stage of an oncological disease or some other disease when it's quite obvious that nothing can be done, and this is terminal stage, then it's quite unreasonable to carry him or her for 300 or 40 kilometers. But when we see that we can be helpful, and what's especially good about it, it's not a secret. I think that these children have some special treatment, so they tell mom, what do you want? You have a child like this. And a child is a child for us, and we treat all children in the same way, and we try to do as much as we can. We arrange large-scale consiliums. We invite specialists, all required specialists, and we try to provide as much assistance as possible. Then Anna also helps us when they take the children for their control. They can provide some other equipment which has not been provided yet. And then we also cooperate with them quite actively, even with the nurses who visit them at home. Because being a public institution, we cannot control all the patients at home. For some of the patients, we do this, and we're always connected. And if required, our doctor can visit such patients. And the children, we then transfer to adults. And if we believe that the child still needs care, we contact Anna so that after they are 18, for her to provide them with enteral nutrition with special care, because the most problematic issue is that in children's practice, it is specified who is responsible for replacement of special tubes for nutrition. Be it a regional or a municipal hospital, they know how many patients of this kind they have, and gastrostoma or tracheostoma should be replaced. They purchase it, and then they come home and replace. And as soon as they are 18, adults do not have these provisions. And in this case, the assistance of hospice is here. We provide gastrostomas and tracheostomas. For now, they do not have it for adults. We have lots of issues to consider for adults as well. I beg pardon. So, like 300, 330 children we annually transfer for adult care. That's quite a lot. And once we started talking about adult service, and the colleagues, Ekaterina and you, and if we have time, I get back to this issue of transfer, because this seamlessness of transfer, the routing of a patient from child palliative care to adult one, it's always a complicated part for different countries and in different systems of palliative care provision. If we have time, we get back to this. And I have one more question from the chat regarding what kind of child's form of painkillers, non-opioid painkillers, as well as opioid painkillers are available. It's always a hard question. Non-opioid painkillers, non-steroid, we all have this in liquid form. And regarding opioid, there is official form. You should know this. And also, we purchase morphine in pills. There is issue with the dosage, but at least it's available. What else? This is not a painkiller, but this is sedative medicine. We have sebazone as suppository for children who need painkillers, I mean oncological patients who can swallow, and they have prolonged painkillers, prolonged morphine, and also a medicine for older children. If you are interested, in the Republic, we have an opportunity to produce liquefied morphine. This is upon prescription, and this will be produced in the pharmacy. If for some reason there are no ingredients, and do you have any problems with this at the level, I mean, at the lowest level? Well, there are always some complex things, and we have done quite a lot in the Republic because Ministry of Healthcare registered a specific pharmacy for every region. The pharmacy which should provide for all the population of the region with this morphine. So this is the order of our operation. We have Children's Oncological Center, and children with oncological diseases uh, go through this center. We cooperate with them, and the children in terminal stage of the disease, we always receive these children, and then we control them if required. We provide for pain killing procedures. We introduce correction into the scheme, and our recommendations are complied in the region. We take care of this, and if there is need, we send our doctor there, or we get in touch with the pharmacist so that the child would be provided with the required medicine. Thank you. Gunnar, would you like to add something? Okay, understood. See, I have one more question, which is normally there at our meetings dedicated to children's palliative care in different countries. This is the lack of staff. There are always complexities in searching for specialists and finding specialists. So people who would share the philosophy of palliative care understand this, and I actually I will definitely give the floor to Anna Ludmila, and I would like to ask some of your colleagues because first and foremost, it's always interesting to know personal experience. So, what brought you to palliative care? How did you, being a specialist who was not in this sphere, not specialized initially in palliative care, how did you arrive? Please share your experience, Ekaterina, Irina.
Good afternoon once again. You know, when people go in palliative care, these are usually people who know what's all about, and they have how to say that. So she just doesn't know how to actually say it in Russian. You see, well, I can see that they have certain aspirations, certain desire to help in this particular sphere. They want to really deal with this care. Well, I'm trying just to explain. So, why specifically palliative care? Because you can help people in different ways. Before that, I worked in a crisis center for women with the children under 3 years old. That is why. Oh, I have always been there. Uh, well, let's ask this young gentleman. So tell us, please. What do you think about this? Why did you decide to work with palliative care? Because you worked in a different place. I mean, tell us. So I worked actually in different places. Well, actually, I am an obstetrician by profession, and also I got special training in rehabilitation. I always help people who have problems. Uh, so she wants to add something else. Well, actually, seriously speaking, I would like to say a few words about this. Within a year, I had two relatives who actually they died, and also they were exposed to some palliative care. And I decided for myself in this situation when it happens, relatives who are not specialists, they should not be left all alone without any help. Seriously, so there should be a person or organization or someone you can go to where you can find some kind of I don't know, help, real help. Yes, we also have a nurse here. Come on, maybe you also can say something. Yes, Irina, if you don't mind, could you say something? Yes, because you are a medical specialist. You know that still we have quite a shortage of people in palliative care, but we have a lot of doctors and nurses, so they are taught to also work with palliative care. Well, I used to work in a different sphere a little bit in one of the clinics, and then quite by accident, I found myself in hospice, working there. Even before I started to work in this sphere officially, I was sent to take some courses. And when I saw those children, when I saw with my own eyes what it's all about, it occurred to me, yes, that I really wanted to work there. But it took me 4 years to come to this decision. I was thinking. How parents could actually live with that. It was that difficult. And then I saw the vacancy and I decided to go for that. I should say that my way to the current level of professionalism, well, it took me a lot of time because for quite a long time I thought that I wouldn't be able to do that. And I remember that after quite a difficult visit, um, I remember how I asked myself, what could I do with that child? So I couldn't give my life to that child, but I could share my knowledge. I could somehow support the child. I could support the parents. That's what I actually could do that. So all through these years, I have been studying without a break. And of course, it takes a lot of, courage and a special attitude to really be able to pull yourself together and to render this assistance in the right way. I actually learned from parents as well, and not only from parents, from different people. I find out more and more about this sphere. Previously, well, I used to visit a lot of conferences, and I asked people different questions, and it was the same question: how you can cope with the very idea of death? How can you accept this idea or digest it? Because well, no one is secured from that. So it can happen to everyone. Thank you very much for sharing your emotions, your feeling. And it's true that I love all those children a lot. Really, I swear, I love them so much. I always ready to stay by their side for hours, petting them, etc. So yes, yes. Yes, now we are, in the stage of the so-called black humor. Yes, let's not make jokes. No, really. Okay, I have a question for the heads, for organizers. How do you find people to work with you, Anna? Probably you could extrapolate a little bit more on that. Well, yes, you're also kind of a professor. Well, we have the problem with staff, with a specialist, just like everywhere else, of course. Previously, yes, we used to take people on board after special courses, but right now it's quite a problem for me because we are not a state-owned enterprise. Just for you to understand, it means that we have a particularly different approach. That's it's really bad. Well, the point is that you also have to take into consideration working experience later on when people go for a pension. So it's quite a problematic issue. Also, sometimes young nurses they come over, but they are not motivated. So lack of motivation is another problem. You tell them a lot of stories, you share information, but they are not interested. But still, we have some new generations, and they are getting more and more interested. We right now have quite an issue with volunteers. Initially, we had volunteers age 15 or 16. It would be nice to have more children like that. They were really motivated. I still remember two boys, well, 15 years. Well, when I was 15, I never washed, cleaned floors in the toilets, worked with the patients, but they did that. But right now, this particular generation, we have quite a problem with that. But I think it will come. It will come. it's very difficult for us to find volunteers, youngsters willing to work on this sphere. And don't forget about such an issue as a salary. This is also an important thing. Yes, as for fundraising, we only organize that in Belarus. For example, this year, a project launched by European Union is almost over, and we will no longer receive any money from Western world. So we have some small grants, 10,000 ruble, 15,000 ruble, but that's a significant sum of money. So you have seen how many people we have, and we are supposed to find the money for all those people, 32 people. Fundraising is getting quite a complicated issue. It's getting more and more complicated. So there are many reasons as to why we cannot actually find specialists. So well, so I understand that we will write it down, your the point about fundraising, and I hope that we will be able to organize some training and we'll train specialists to work with that. And what about motivation? So you think that it's quite difficult to motivate young people. No, I have a different question. Sometimes you need to breathe out, relax. It's like an intensive care. Breathe in, breathe out. Right now, we are breathing out. We have to accept that. Yes, we have this breathing out moments where we can not do anything, and we cannot force a person to become a good nurse in palliative care. We cannot force a doctor to come over and say, yes, I'm ready to work on this sphere. No, we have to wait. We have to push them a little bit. And we should take some small steps to do that. That's why we have these centers. And sometimes, yes, we organize special programs for doctors. So doctors, they come over and not all of them come back. So some people receive information, then they come back. For example, Ira, it took her 4 years to get ready for that. We need to have this art of persuasion. We need to be able to persuade people, but I'm not that strong at it. I'm not that good at it. But again, yes, we don't have enough specialists. That is why life is so difficult in the regions. But I'm optimist by nature, and I think that we breathe out and everything is going to be fine. Well, I understand. I really liked your idea. Well, yes, you should go step by step, slowly, but in the right direction. I think that the society will be changing, and of course, we will have all it takes to organize our work. So you touched upon the issue of volunteers. Could you say a few words about how you actually provide assistance for volunteers in hospices and in the center, if there are any? And how do you structure this work? Who is responsible for this work? How volunteers are trained? As for volunteers, well, we have had a special program for them for quite a while, and it takes a lot of coordination and organization and control. I should say that, yes, we need to develop special documents. Poland is really good at that. So I remember back in 1997, 1998, 7 and 8. Well, I was absolutely impressed by the experience. Of course, we always sign contracts. We also discussed the number of hours volunteers are supposed to spend working the center or hospice. We also have a website. We have a special control body for this work. I don't know if it's the case now, but prior to all this, work of volunteers in the children's hospice was a really good thing, you know. It was quite popular, and I remember that we could also give them a special certificate proving that they worked as volunteers, and it was something cool. For example, 100 hours per year, it was the case. But in fact, for example, volunteer might work only during 1 year, but they ask for such a certificate. That is why we have curators who control all that. We have volunteers club, and so once a month we organize meetings with them. We have different directions. Previously, we had volunteers who helped us with the transport, but it was the case 2 years ago. It's no longer the case. And now we have, by the way, I would like to thank Russia for that, and Yandex Taxi. Yandex Taxi helps our children for free. For example, we have 5 free trips for our families per week. And also we have volunteers responsible for that. So they work as curators. They work with all disorders. Another problem with volunteers is that they all want to help children, but they don't know how to do that. That's why we have special courses for them. So we have 2 week courses for volunteers. It doesn't mean that, for example, 2 week without a break. No, for example, once a week, etc. And also that they get special diplomas that they have underwent, undergone a certain number of hours of training. They work with the nurses and they work with other specialists who also share their knowledge and experience. They also work with me. So we have special courses and also selection stages. Yes, of course. And I should say that out of 10 volunteers, usually only one stays with us. So 10 people sign in and only one stays with us. And so even in this case, we are lucky because sometimes no one stays with us. There are volunteers who decide to stay with us for the rest of their life. Well, I can see the following trend that I can see that volunteers they're getting younger. So before that, it was 2023, and right now, for the first time in my life this year, we decided to take on board volunteers aged 15 and 16, and I'm so proud of. Our children, Belarus, and I should say that those children, they are incredible. We even send letters to their mothers saying thank you. And by the way, her son also worked as a volunteer with us. Lyudmila Alexandra, could you say a few words whether in state-owned enterprises we have an opportunity to work as volunteers? And if it's the case, how it is more organized?
Well, our specialists of our inpatient department, our psychologists, our teachers, they have volunteers who help them in some events. And we do not work at home with them. We work in our um, institution. Of course, all the events that we arrange, all this is based on volunteering. Some artists, some singers who can show something, who can teach something. There are volunteers who help to purchase, some stationaries or something like this, whatever is required for us. I mean, in this sense, and such volunteers who would come to us, take care of children, we do not need this. We have special staff hired specifically for this purpose. And we have a dream, actually. This is also a project, and this is done by volunteers. This is also for oncologically diseased people. And we ask parents what they want, so that it wouldn't like a microwave oven. It's not a dream of a child, but a dream of a mother. And this program is very much in demand. And they want to be volunteers. They are ready to buy. Of course, this is a dream of a child to ride a horse or to go somewhere. This is provided by volunteers, but it is, of course, under control, under surveillance, because we are responsible and liable. It's very important. Those who listen to me, I believe that I would recommend you such experience. It's a really very good kind of experience. Thank you so much. This is a valuable recommendation that you described directly, where to search for description of a successful and efficient way of working with volunteers. And out of what you have mentioned, it's also important to single out. You have mentioned that you have a special person working with you, and unfortunately, quite frequently, this is a position of which doesn't have sufficient resources for different reasons. And the volunteers' work is organized by a person who is also a volunteer. And that is always the kind of a complicated part, uh, so to speak, high risk for organization and for a patient. Thank you so much. We have just a couple of minutes, and the last question I would like to ask, that is regarding your plans. Maybe you have some projects which you plan to develop, to start something new. If you have such things, such plans, Well, I'm a realistic person, and my plan is to survive. My plan is to survive currently. And I have a theory of capsuling, and now I'm at this stage, but we cannot deal without plans. If you do not want to do this, then you continue. First of all, we develop habilitation. Now, this is very much in demand, and that is very much needed. You see, Zlat saying that we need a swimming pool. Yes, we started with this swimming pool. We already had an agreement, but a person went for a childbirth vacation, and the problem is a different one. We wanted to do habilitation in swimming pool. That is a cold water, and also fear of people who take ill children. They're afraid. We'll try to do this. The second pro program is establishment of center for young adults, what we have mentioned. This is kind of a bridge which we actively work at with the adult services of palliative care. Unfortunately, palliative care for adults is mostly aimed at oncology, and we have a lot of oncological diseases, and we do a lot. We would like to make a separate program, but for that we need money, we need training, specific education, as it has been mentioned by the psychologist. For me, personally, it's quite hard to work with adults. I got used to work with the children. The same for many other people. Again, training, again, educational project, and so on. And then that has already been mentioned. This is basically educational project for all doctors, psychologists, perinatal centers to provide clear knowledge about palliative care for people to understand at least about some simple things, some basic things. And by the way, we should teach SOSUM. I will provide a small example of bad SOSUM. In one city of Belarus, we have reached to make an access to the flat, the first floor. A neighbor went out and lied down, and she didn't allow to make a specific access to the flat. She said that no disabled people will go under my window. Then we arrived, we talked to her, and as a result, she explained the reason. Her mother was dying, and it was too much for her. It was too nervous, and she doesn't want to see disabled people again. We should educate people. Finally, she agreed, but time was lost. So these educational projects are of utmost importance. This is our plan. The task is to change relation of society. This is really a global task and of super importance. I totally agree with you. And from this request, from the bottom, so to speak, a lot is happening and a lot has changed. Ludmila, would you like to add something? Your plans. Well, as to plans, first of all, this is development of palliative care locally in regions, then educational program. We work together, by the way, and we started this School of Palliative Patient. We went through 3 regions, and we are going to change the format for the next year. Now it is like this. So this is our plan. And as to the swimming pool, it's Anna who is to blame. When she was constructing all this, she could have constructed a swimming pool as well. Nobody prevented her from this. So we will press over her again for her to continue constructing the swimming pool. We have quite a lot of space. Thank you so much. And I would like to wish you for all your ideas to be implemented and to reform the projects that have already been launched, how you can improve them and make better. Thank you so much. Once again, I would like to express a gratitude to our speakers. This is a very warm-minded team and a very warm impression from you. Anna Gorchakova, Director of Belarus Children's Hospice, Ludmila Bomberova, um, Director of Republican Clinical Center of Palliative Care for Children, uh, Zlat Kizin, abilitologist of Belarus Child's Hospice, Irina Zueva, nurse of Medical Hospice, and also Ekaterina Sidoruk, psychologists of Belarus Children's Hospice. Unfortunately, we cannot see all of you at the same time. Thank you so much. Also, I would like to thank the team of PACE Foundation, Ksenia Komenova, Felix Vitogis, Roman Sklotsky, Елена Lipova, and myself. We were happy to work for you, for our listeners, and also thanks to our interpreters, Maria Biskova and Ludmila Vasiluk. They helped us to arrange the record of this webinar into languages, and it will be published in YouTube channel of PACE Foundation. And by the way, we always have quite a lot of views. We are proud of this. The time zones are different, and not everyone are comfortable to join us online, but they are happy to watch us later. I would like to remind you about our plans. The 30th of October, we have a meeting with Nura Federmesser, who is the founder of Vera charity foundation and who is headliner of Palliative Care. And she will talk about arrangement of the system to provide palliative care at the level of the state. And once again, I would like to remind you about our Telegram chat for specialists in palliative care from Eastern European countries, Central Asia, focuses. And so please, now my colleagues will provide a link. Please fill in a small Google form so that we would be able to introduce you to our colleagues properly. Once again, thank you very much. Thank you and good luck.
Спасибо.